www.healthcmi.com. Acupuncture continuing education online today. A lot about acupuncture for the repair of knee arthritis cartilage damage. If you go to healthcmi.com and click on news, several articles in March of 2018 cover this topic. Let's look at some of these groundbreaking studies right now. One of the ones that came out on March 30, 2018 was highlighting how acupuncture regulates proteins in the body. So acupuncture stimulates knee osteoarthritis cartilage repair by regulating proteins TGF-beta1 and IGF-1. So researchers found out that acupuncture accelerates articular cartilage repair in the osteoarthritic knee by inhibiting the overexpression of these blood factors. Using laboratory experiment instruments, they also discovered that acupuncture smooths the surface of knee cartilage while regulating cell proliferation and differentiation. So this is a great article. Take a look at it. Acupuncture knee arthritis cartilage repair discovery. And yet another came out very recently on the same topic about repair. Let's take a look. This one, March 19, 2018, acupuncture repairs knee arthritis cartilage damage. Let's take a look at this article very briefly. Acupuncture stimulates cartilage repair for patients with knee osteoarthritis using MRIs. Researchers have quantified the therapeutic effects of acupuncture. Within 4 weeks, acupuncture successfully improves the condition of cartilage in the anterior, medial, and lateral tibial regions of the knee. Many scores were used. This goes into high detail about the MRIs, the exact acupuncture points used to achieve these results as well. This is also very much worth looking at. Again, this article, March 19, 2018 at healthcmi.com in the news department, just click on news, is entitled Acupuncture Repairs Knee Arthritis Cartilage Damage. This gets very specific, as does the other article in the acupuncture points used. And here in this article, the exact results from the MRI rebuilding chondrocyte matrix in the knee. So we now know the biochemicals involved, that acupuncture stimulates healing through specific proteins in the body by stimulating them. And we also know that acupuncture through MRI studies helps restore the knee as well. So that's two, and that's not all. We also have another article that came out March 22nd, 2018. Acupuncture improves knee meniscus repair. And here people did more of a subjective clinical control trial where they measured motion, stability, ability to walk, jump, climb stairs, things like that. And the patients did much better. This is no surprise to licensed acupuncturists. We do a lot with MCL damage, ACL, meniscus. This is standard. I will say, for the licensed acupuncturists listening out there, no surprises here. Needling of Shion, Shisha, a rare point, which is directly between Shion, both Shion points, lateral and medial. One of them, of course, the lateral, is stomach 35-2B. Then also Heiding is also very popular. And, of course, the other points around the area. But it really comes down to Shion, Shisha, and Heiding in most of the research that we see. And so that's a hot tip for acupuncturists. It confirms what pretty much is standard procedure. At healthcmi.com, we are preparing a continuing education course for licensed acupuncturists to get into more particulars about how to apply those points. Because it turns out that the deep needling technique is often very effective when we're using a 90-degree angle of the leg. So a patient is seated and then applying Shisha with Heiding. So Shisha is directly below the patella in the patellar ligament, and Shion is lateral to each one in the eyes of the knee, we call it, in the little hollows at the lateral and medial aspects of the inferior portion of the patella. So those require slightly longer, thicker needles to get that done. We also have people getting success with the supine position, lying face up. Now that's important because not everyone really, especially on a first visit with acupuncture, is ready for a seated treatment with a longer, stronger treatment like that. And then sometimes a slightly shallower, more refined insertion for a better experience might be available to people at that time. Then a little electroacupuncture from one Shion to another can work. but the results are clearly showing that manual acupuncture is more effective with the 3-point combination of the 2 Xi'an points and the Shisha plus He Ding alternately, or in combination with that. So that's a little wrap up for that. If people are having arthritis of the knee and knee pain, knee problems, even strain or sprain sports injuries in particular, this type of acupuncture is the way to go. For healthcmi.com, I'm Adam White, licensed acupuncturist. Thank you for listening. www.healthcmi.com.